welcome back to Practice Underwater. If you haven't noticed yet, we've totally revived the segment. I haven't done Practice Underwater for like 4 years, and now you've probably heard a few of them now. So I'm here with our real doctor who wanted a very fake name. So I went with Alejandro. And one thing I really appreciate about this real doctor fake name, Alejandro, is Alejandro liked some of the names that I picked before, like Gregorio. And so Alejandro wanted a name. And I like to pick a name that I find is fun to say because it makes it easy to remember and fun to say on air. So Alejandro is going to be with us today. So Alejandro, why don't you go ahead and just introduce yourself to our audience? I think briefly we were discussing before we hit record about how you may not be the typical, Practice Underwater guest. So maybe just kind of introduce yourself, and obviously, make sure to remain anonymous.
Oh, hi. Yes, I have a wonderful name, Alejandro. It's and perfect. That was a very good pick, George. But yeah, I'm a general dentist. I'm located probably 20 minutes outside of kind of a mid-sized.
I would call
city.
it a secondary market.
Secondary market.
Yeah, just leave it at that.
Okay, in the Midwest, and I've actually owned my practice for over 20 years, and it was it's kind of funny. When I first bought my practice, I thought it was a fee-for-service practice, and then not really knowing at the time, I realized it. And in the time, Delta Dental was pretty much fee-for-service in the market. They paid pretty much your fees, and so over the years, we've kind of transitioned to fully fee-for-service. As of 4 years ago, we had dropped Delta, so we're a fee-for-service practice for over 20 years, and we have our families here, and 4 kids, and busy life.
Yeah. So maybe let's just take a minute and talk about that fee-for-service element, just to make sure I understood properly. So, you bought the practice 20 years ago, mm-hmm. and 20 years ago you thought it was fee-for-service, but then when you entered ownership, you realized that they took Delta. And then as of 4 years ago, you dropped Delta and are now fully fee-for-service.
Yes. And over the years, we had some transition where we had gone into a couple other networks. And actually, I think the practice actually had taken, when I took it over, they were taking Anthem as well. And it was marketed as fee-for-service, and I was just a young naive person, but it did get mostly as full fee, though, at the time, though. So, but yeah, we're full fee-for-service.
So, I guess so maybe now that we've just kind of talked about the fee-for-service element, how you got into ownership, 20 years doing it, maybe for our audience to kind of talk about, like, what's the 20 years been like? What has the experience of ownership and practice been like?
It's been good. We've definitely had some, highs and lows, and I think it's times have changed a lot. Different types of the economy's definitely gone through some stretches, and we've been through a lot of different times where we've kind of survived through them, and we've interesting. I think one of the interesting things is we're mainly to be able to do this. I mean, we don't do any crazy treatment, mostly bread and butter type dentistry. We do, some other stuff, some, aligners and things like that, but nothing too crazy. I think I like it that way. We have, I think the big transition though was the fee for service, like right after COVID, and that definitely was that was interesting. When we dropped that, that's probably the biggest challenge I've had in practice is and I think along that time, it was also becoming harder to find employees, especially hygienists, and the wages are changing. So that's probably the hardest part was when we did that, and now we're kind of on the other side of that, kind of looking to grow even more.
Yeah, so maybe you've brought up the going fee for service multiple times. So maybe just help me understand. It was post-COVID, so I'm not exactly sure what that means. So maybe help me understand what was so memorable about the process of going fee for service post-COVID, shortly thereafter?
I think it was the in our market the locals, basically the state Delta just pays most of the plans pay very low when you go out of network. So that was probably the biggest the biggest challenge. And at the time when we went on a network, that wasn't the whole thing. I see how that talked a lot more about now. I think as more people were going on a network, but a lot of a lot of networks, like say Sigma, you got a network. Most of the time, you get paid your fee. A percentage. They basically will almost pay up to your UCR fee. Delta maybe 50%, 30% sometimes. So we lost a decent number of patients from it, as much as we prepared. So
Yeah, I think Delta just has a way of making it as inconvenient as possible for their subscribers to the Delta insurance to go to an out-of-network office. I mean, they really have a way of doing that. So maybe do you want to just touch on that real quick for our audience? Like for somebody who maybe isn't as familiar, like what types of things made it very challenging for people to stay with your practice, with Delta?
The biggest, I mean, we tried to prepare the patients for knowing that they would have to pay us in advance. That's definitely a huge hurdle, is prepaying and prepaying for their services. We tried to give them payment options, and we, some people just initially didn't come, and then other people, they tried, and then what we found out was Delta was a lot of times reimbursing them like half of their visit, and then they would be mad that they only got half of their reimbursement, and they paid us, they say, $400, but then they only got paid back $200, and it's, at the time we weren't exactly sure how much they were going to pay. We've definitely changed how we talk to patients about that, but sometimes people still get mad if it pays very low, and you can't pre-authorize everybody, and it's tricky. So that was probably one of the biggest hurdles, and marketing's tricky too, because when a lot of the patients you do marketing for, a lot of them will have Delta, so you're almost marketing, and then you bring a patient in, and then they find out. And we try to get as much information up front as we can about their insurance and what they have. But inevitably, people come in, and then they get mad that they have to pay up front, and then sometimes they'll even leave because they don't want to stay.
Yeah. So okay, so now we've talked about that. So now I guess maybe help me understand, how did you find shared practices, and how did you become familiar with what we do? I know that before we recorded, Alejandro made the mention of dental 3-pointer. So like maybe help me understand your familiarity with what we do and how you came to hear about us.
I've been, I'm an avid podcast listener, and I've always been aware of your podcast. I've heard you guys on other podcasts, and I know a lot of time. I think when the show first came out, you guys talked a lot about just like buying practices, growing practices, and things like that. And it wasn't always the most applicable things, but I think there was a crossover of other guests that I've listened into. But I think since the reboot, when you did Shared Practices 2.0, I listened to you guys on. It was actually it just seemed more pertinent. And then when you had Scott on there, and you guys all started talking, and I think that just got me listening. And then probably in this last year, I've really become an avid listener, and I think a lot of what you talk about has a lot to do with my thought process. And I read the book, and I think that really makes sense to me. Like because I'm at the point now with my practice where we've been really struggling to find that second hygienist ever during that whole process. Since we dropped Delta to now, we've had a hard time finding a second full-time hygienist, and we've had some people help us out days here and there, but I have someone that's going to start 2 days a week in the summer, and I can just see the vision of how your philosophy works. About we just plug these people in, and new patients, existing people that we can't get in all the time. I think I can really see the practice growing a lot.
Okay, so well, that's great. So you read Dental Moneyball, and it seems like your big takeaway is you just kind of understand the concept, right? Patient flow driven growth. So maybe just kind of for our listeners, maybe some of your takeaways from Dental Moneyball would be very helpful, and then we'll try to transition to your vision and what you're looking for moving forward.
I think one of the big things, I like the different avatars, the styles. It's like I realized that I'm being a productive solo doctor is just a viable. I always thought you had just having different. I think that's one of my biggest takeaways is that it's okay to be in the lane I'm in. It's like everybody always wants to grow and, multiple doctors or, it's like, and maybe that at some point I do want that, but I feel like the the fact that you can go from different stages, it just makes sense, like how many, what type of production, like how many patients you need, and I think the philosophy, I think one of the biggest things that I took was the value of adding in that extra patient, like, as, an existing patient can, be, 10, 9 times the value, or a new patient could be, what is it, 10, 12. I mean, it's crazy. Like I just see the cost of that we're missing out on, where it's just potential that we have, and so that's probably the biggest thing for me.
So excellent. And I think that, you're an interesting practice. So maybe, Alejandro, can I take a few minutes and just for our audience, just kind of go through your numbers, and I'm just going to talk out loud. And,
Sure.
And then I think that that'll just be very helpful for everybody to just understand, Alejandro's practice. So Alejandro's practice, as I'm looking at the practice by numbers right here, historically in the last 12 months has collected 1.13 million. So, Alejandro has properly identified himself as a productive solo. Now, the thing about Alejandro's practice that is instantly interesting to me is the active patient base size is 875, and there's 4 hygiene days per week. So there's 1 full-time hygienist, and something that I'll talk about with Alejandro in a minute, but there's soon to be 6, right? So there's a 2-day-a-week hygienist, I'm assuming, starting in the summer. Is that correct, Alejandro?
That's correct, yes.
So now, I think the thing that's, so just the kind of high-level numbers, in the last, so like if I look at last month, which is just like an easy thing to look at whenever we're taking a look at like retention, Alejandro reappoints at a 90% rate. So, like the hygiene reappointment, right in line with where we like to see it. 93 people came in, 83 left with appointments, 10 did not. Like that's good. And the thing, treatment acceptance, patient acceptance, also strong. So it seems like, Alejandro has a strong rapport with the patients that come in. And now here's where it's a little more interesting. So we have 19 new patients seen, of which we kept 58% of them. So, maybe call that 11 patients or so, 11 or 12 stayed. And going inactive is 11 as well. So, there's a bit of a stagnant patient flow element to this that I'm already noticing. And so I think that, my first questions towards Alejandro are really around, what the feeling in the practice is like with the hygienist schedule. Because when I look at, our kind of generic numbers are, we like to see around 800 patients for every full-time hygienist working 4 days a week. So if I look at Alejandro's practice, there are 875 patients, and there's 1 full-time hygienist working 4 days a week. So I think on the surface, I would classify this practice as like a patient-based size as a solo, but revenue-wise as a productive solo, and that's the fee-for-service element at play. And so I think that my first question, Alejandro, is, what does it seem like in the practice with that hygienist schedule? Does it seem like it's full and like hard to get people in? Or is it one of those things that it's like, it's just, I'm just curious to get your sentiment on what your hygienist schedule feels like day to day.
Her schedule is generally pretty full. We do have some issues with no-shows and cancellations that we're working on. So it'll be full, and then inevitably someone will drop off, and it makes sense with the amount of active patient. Well, it's hard sometimes to find people to put in there, but we could probably do a better job at coming up with a list of people to come in. But it is hard, like, to get a new patient in. If she has an SRP, she's just searching somewhere to put them. And we have had another hygienist helping out on some Mondays, and there's one that's going to help us out in June for about 5 or 6 days, like here, she's kind of maneuvering her schedule, but it is kind of hard to get people in. I feel like we're trying to get a little tougher on when they don't confirm in time, telling them that, hey, we may have to put someone else in this slot if you don't confirm by 12 o'clock today or something. But we've been trying to get a little firmer with it, but that's where I'm thinking if I have more openings, we'll be able to fit more people in, and even more new patients in too.
Yeah, so makes total sense. And I think, as I'm looking through your practice by numbers, I do think that you're at that like one full-time hygienist with a little bit of spillover, is kind of the numbers that we're seeing on our end. So I think that is confirmed. Can you just walk me through your staff size?
We have two. We have a scheduling coordinator, a treatment coordinator, and then two assistants, and then the hygienist, and pretty much that's the. And then, like I said, the other hygienist who helped us out a little bit, but she's not even there anymore. So she's feeling she'll be kick off us a couple more days. That's it, and then so that's pretty much everyone that's there all the time.
And then is this so? You're adding two more hygiene days, so you're going to go from 4 to 6. And is that like a permanent thing, or is that something that's temporary? Like, because I don't know, it kind of sounds a little wishy-washy. So I just want to just clear. Is it like you're adding it and they're going to be there full-time moving forward, or like full-time as in the 2 days consistently and not going to stop those 2 days?
Yes. She has to. She's graduating, so that's why she's going to graduate and then come basically.
Got it.
So yeah, so we're adding those in, and ultimately my goal is to have her there full-time.
Okay, and now. I think if somebody were to just say, like, what are your pain points? Like, similar when we like you have a patient coming in for a limited exam where we're like, what's the chief complaint? So I think that, I'm just curious, kind of as an owner, what are your pain points?
I think consistently keeping the schedule full. My schedule is one of the pain points. Like just openings in my schedule is very, very frustrating. I mean, we've been doing a pretty good job of keeping it full, but when we do have days here and there that it isn't busy, and then the people aspect of it. Just I think that's it's hard. Like we've had a hard time finding employees when we've needed to, and the assistants. We've been trying a hard time keeping 2 assistants there, just because of people moved on, or it's just kind of hard to find. We're looking for the right person too, I think.
Yeah, I mean, I think if a lot of our audience is listening, turnover at the assistant position and finding those long-term fits who are great team members at the assistant position, that's a struggle everyone's having. Like, I think that is like an industry-wide challenge. So I guess now on the flip side, like if I could wave a magic wand and Alejandro's living Alejandro's best life, what does that look like at the practice? I'm specifically talking about ownership, right? I don't want, like, we could get into all the other stuff, but like, yeah. I'm interested in Alejandro's life as a practice owner. Like, what does perfect look like?
I think, I'm maybe be able to work Monday through Thursday with a busy schedule, to be able to do I like doing crowns, just doing crowns all day and having a nice, having my 2 hygienists full, and then be able to have, a team that's getting along well, that we can, and we're doing well enough at the office that we feel good about, doing some fun things as a team, and keeping connected. And I know there's never going to be a time when there's no drama, but just as little drama as we can. And I think when everything's flowing well at the office and the schedule's busy and I'm busy and we're meeting our goals, I think it really helps.
Okay. And, you've been at this for 20 years. Before we recorded, we talked about our kids' ages and whatnot, but I won't, Alejandro, as far as we know, has no kids. So, I think how many years do you think you have left? What's on the other side for you? Just curious to kind of see your appetite for how long you want to work.
I actually, it's funny, I actually enjoy doing dentistry, and, I definitely see myself working 10, 15 more years. I would just like to be in a position where, in maybe 10 years, it's more of something I want to do from, maybe I'm not doing it 4 days a week, but it's becomes more optional over time, as far as having to work. But I enjoy it. I enjoy dentistry. I enjoy going to work. I enjoy learning about, different dental things, and it's almost like becomes like almost like your hobby in some ways. Yeah.
So maybe I want to kind of double click on that. I guess, like, do you have like a personal financial path to that? Is that something that you work on and think about? Like, I want it to one day be optional and I'm doing these things to allow that to happen. Like, do you have any type of process that you're going through to kind of allow dentistry to be optional one day?
Yeah, I mean, I've generally, but not really. I think just over the, I've had a path, and we had a point where we were starting to track things, but it's kind of like it's just with things up, things the way they change in the practice. It's just I'm more focused on just making their practice, solid, and I kind of know when we reach a certain point that there'll be a lot more just liquidity eventually just with once to pay some things down and do some things that way. So I mean, I think I definitely need to do a little deeper into that and have more of a plan, but like I said, I feel like I'm to the point where I know I'm going to be working for a while, and I actually enjoy working. So
Yeah. So, I see here on your form, like, increase your take home, pay down your debt, have a creative path towards financial independence. So I guess, do you feel like, so I guess maybe we can touch real quick on, income at the office, percentage of overhead, whatever you're comfortable sharing, Alejandro. Remember, like, no one knows who you are. So, what do you feel comfortable sharing about how that process is going for you?
yeah, I feel like we've had some just with some with the practice, and just for different initially, different, not really expansions, just upgrades in the practice and different things we've done over the years. I feel like we've got, there's probably more of like, I'd say maybe $500,000 of take home, but then there's, we're using some of that to pay down some, pay down some debt, and it's probably closer to half of that we're using to pay down debt. Where eventually, when that's gone in a few years, then that could become more of like a take home type thing.
And what debt do you have that you're paying down? Just curious.
Just some practice loans and some working capital loans, and some equipment too.
Got it. So just standard stuff. Okay, and now I'm interested in your clinical box. So, what procedures do you do, and what procedures do you enjoy doing?
We do a lot of restorative. I think I really enjoy, say, crown and bridge and restoring. I do a lot of restorations of implants too. We don't place implants, but I have a good relationship with my oral surgeon, and we do a lot of we even do like hybrid cases and things like that. So I really enjoy restorative dentistry, and we do some other things. So some I'm trying to think what else. Just even to basic restorative fillings and things like that. I mean, I'd much rather be doing crowns, but and then in hygiene, we have we offer some like laser whitening, some laser procedures and things like that too.
Do you have, so it's something that I find interesting. So you've talked about, like having that passion and love for dentistry. And is that passion and love for restorative dentistry, or is that passion and love for is there other elements of dentistry that you have that with, or is it mainly just restorative dentistry?
Probably mainly restorative dentistry. I mean, I like technology and getting into some of I don't really. I've had a little bit of experience with milling crowns. That really wasn't. I really didn't like all that. Yeah, that's seeing those margins isn't really my favorite thing. But I think just being able to provide good quality restorative dentistry for patients. I'm not really big into surgery. I've kind of I go back and forth. Yeah, endo I kind of have a love-hate relationship with. Sometimes it's great and sometimes it's not. But I do like diagnosing. Being able to have a patient come in and do some X-rays. Kick a CBCT and just kind of diagnose what's going on and kind of create a plan for them and kind of help them out. I think that's something I really enjoy too.
Do you like night guards, or do you do a lot of night guards?
I do. We do. I definitely could do more. And we actually could print them. We have a 3D printer, so we could even do them in the office too.
Ah, yeah. So you remind me a lot of myself as a dentist. When I teach courses, I always say my procedure mix was crowns, fillings, and night guards. And
yeah.
I say night guards because I just loved I mean, I wear a night guard every night. I just like a really big believer in the effects of wear and all that. And I found myself like that was a big part of my procedure mix. Like I would be talking about night guards a lot, and but like I think that I feel pretty clear on who you are as a dentist, and I think that I'm also clear on kind of the direction that we need to go. So maybe I can just kind of take a few minutes. I've been taking notes here, and like really just kind of walk through what perfect looks like for you and that vision. And I think that you said it yourself. I mean, I think that you're very clear. You said it yourself. You said there's nothing wrong with being the productive solo. And, like for you, you very clearly fall into that camp to me. It's like you are very squarely a productive solo in terms of your personality, what you like, how like Monday through Thursday, busy schedule, 2 hygienists that are full, a personal schedule that's full with restorative, crown and bridge, having a good culture as a team, some semblance of organization on the drama, really just enjoying the practice of dentistry, having it be sustainable, having it be something that you could do long term, and just kind of settling into a groove where things are smooth. It's running, income is great, you can do fun things with the team, and you can just inch your way towards your goals to the point where maybe one day it's optional. And that's kind of what I see for you as, just kind of the path. So does that sound like what, I mean, I kind of wrote down what you said, so I'm assuming that sounds very similar to what you're looking for, but I'm assuming that I'm not missing anything, correct?
No, that pretty much sums it up, I think.
Awesome. So I think that, if I were to, so then like, we're going to go to part 2. And in part 2, we're going to talk about like where you're at, what's next, how do we get there? And I just want to take a minute and kind of like sum up what I've learned so far and where I see there to be opportunities to grow. So I think the first one is we're going to talk about is the schedule being full. So I think that that's a section that we're going to spend some time on, which is really, how do we fill up the schedule? How do we make sure that your schedule is full? And that's going to have a lot to do with the hygiene component, and we'll talk about that. So I think the schedule being full and the doctor side particularly, like that's something that we're going to dive into in part 2, and we'll talk about that in more depth. The second thing that we're going to dive into in more depth is team management. So I'm really interested to hear more about the team dynamics, what's not working, and how can we kind of create that. The productive solo at their best is a team that just knows what they're doing. Everyone does their job, and they just work together. It's a kind of a smaller, tighter knit group, and everyone knows what they're supposed to do, and it's just supposed to be light. Like that's kind of how I would describe it, as like light and empowered. Like those are the 2 things that you're really looking for from the team. You want them to each be empowered in their roles to thrive. And then you also want there to be a lightness to it where it's like we're just kind of going about our day. We're just doing what we do. And, I'm just curious, do you have a team incentive or anything like that?
Yeah, we do. I did more of like we have a commission for the hygienist. Like if she reaches she's paid on hourly, but if she reaches certain goals, then she gets like a percentage of the over. And then we've been doing this like daily grab bag thing for a while, which I think at least gets them thinking about the production for the day. And then and the other thing I did set up is more of a collections production based. Like if we reach a certain amount of collections or production per month, then the team, the non-hygienist part of the team, can get a certain percentage. But I was only doing that after they had been there for like a year, just to kind of encourage them to stay, basically.
Yeah. And I think that all of this I'm going to dive into in the next part, and I'm going to want to hear a lot more about all of it. Okay. Because ideally, the best thing to do would be to just keep doing what you're doing. So, I'm just going to like hear, because, and I don't know if I've I haven't stated this yet, but I would ideally, so your practice right now, historically, we talked about this 1.1, number. I have a number in mind for you, but I'm curious, do you have a revenue number in mind for like in this perfect world where everything is smooth and we're really nailing it? Like what type of collections per year are you really thinking is possible here?
I mean, I really think with another hygienist in my schedule, I could be more closer to like 1.8, even pushing 2. I mean, I don't see why we couldn't. And we've had months where we've done that. It's just, I think just having the schedule full is kind of the biggest. That's kind of my stretch goal, you know.
Yeah. Well, it's interesting. Yeah, I think, and I'm just super frank, so I'm going to be frank. I have the number I have is like the 1.5 to 1.6 range. Mm-hmm. And not necessarily saying that there's not like for sure you can. And I think that for you, like 2 busy hygienists, like, you know, are you kind of a fast producer? Like, do you do things quickly, or are you more of like, you know, take your time type dentist?
No, I can do things quickly. It's just, I like to focus on the patient I'm working on at the time. You know what I mean? Like I don't like to hop around from too many rooms to too many rooms, but I like to empower the assistants though to make the temporaries and the scan and things like that. Like I can prep fast, and you know, it's just a matter of, I do like to spend my quality time with the patient though. You know?
Yeah.
And then
so I think that something that we've noticed is, and I think your fees are higher with fee for service, right? So maybe 1.8 for you is like 1.5 for, you know, or 1.4 for like a PPO office. But I think that like something that we've noticed just from doing this is getting to 1.5, 1.6 is it's for some reason significantly more straightforward than getting a solo practitioner up to the 1.8 to $2 million range. For some reason, that jump from, well, I actually know the reason, right? It's like you start to push the limits, right? So for you, it seems like the limits would be the one patient at a time thing, right?
Yeah.
Like I think that to get to 1.8 to 2, you said that you've done that in some months. So what do you mean? Like, did you guys do 160 in production collections in a given month?
we have like a couple times, like it was more of just a lot of stuff packed in, and you know, we used, you know, and I'm trying, and it was probably back when we're pre Delta drop too, so we didn't collect that either. So
yeah.
So I'm thinking, yeah, it's now I think about it. So no, but I think honestly, the 1.5 to 1.6 is a good number though. I mean, that's you know, if we can consistently, that would be definitely a big, you know, to consistently stay at that number would be a big improvement. You know, huge. I mean,
yeah. So that's the path that I see is to really get you to that zone. So a lot of what I'm going to be talking about in the next part is really like, what's the difference between where you are today and that 1.5 to 1.6 million dollar practice. And I think the thing that like I really like about Alejandro is like you're really sure on who you are. And I think that like there's a lot of people who would come on here and be like, yeah, you know, I want to get into implants, I want to be placing implants, I want to be doing endo, I want to be seeing multiple columns of people and patients, and you're like, I love restorative dentistry, I want to see one patient at a time, I want to remain fee for service. And I think that all of those things are really important to like stay true to. So I'm going to try to, in the next part, you know, make sure that this is your practice, that it embodies who you are and how you work, and not try to put, you know, someone else's vision on top of you. So, you know, I think that's what I have for this part. I'm very clear on where we're going, and, you know, we're going to dive in. And I think that the two biggest things that we're looking for is that schedule full and the staff component, and really getting those two things with that second hygienist. Like that's the path that I see to get you to where you want to go. So, you know, Alejandro, maybe anything I missed for our audience before we wrap up the first part and we have you back on for our next episode?
No, I think you've explained it all well, summed it up good.
Awesome. Well, Alejandro, we appreciate you coming on to Practice Underwater. And we'll go ahead and talk to you again at the next episode, where we're going to dive deep into your situation and really kind of talk about the path from where you are now to where you want to go. So thanks for listening to this episode of the Shared Practices podcast. I encourage that you come back at the next episode. We're going to go back with Alejandro into part 2, and we're going to talk about how to get Alejandro to that $1.5 to $1.6 million productive solo, where, you know, it's steady as she goes and long-term, something that can work Alejandro into his goals. So thanks for listening, and we'll see you again on the next episode of the Shared Practices Podcast.